Welcome to HCC's webinar on private insurance. This is part of a series that we're doing all year that's covering health access, health advocacy, and health policy to help patients be able to better access resources and advocate for themselves. Today, our speaker, Michelle Rice from NHS, will outline changes coming to private insurance, as well as both standard private insurance and self-funded plans through employers, resources for patients, and opportunities for patients to advocate for themselves. I also want to take a moment to thank the sponsors that are supporting this series this year, Takeda and Sanofi Genzyme. Thank you so much for supporting our program. So with that, I will turn it over to Michelle.
Which I think just brings us to questions.
There was a question submitted via chat that asked, who is responsible for surprise bills?
Well, I can tell you that that is something that I think you need to understand. If you get a bill, you need to contact your insurer right away and say, I don't understand, especially if it's within a hospital facility that is your preferred, is a preferred provider under your plan. I think you go to, or a lab or whatever, if you go and you contact the health plan and say, look, I went here because this is where you told me to go. Can you tell me why I received this bill? One thing I will tell you that's interesting is sometimes it ends up just being a billing or coding error. And what I mean by that is, while there may be 10 employees in a lab or 10 employees in a physician practice, not all of them will be contracted with every payer, okay? So it may be that 5 of them are contracted with these 10 payers, 5 of them are contracted with these 10 payers, which is why sometimes, I'm sure you've all had this, and I usually have it with lab work or imaging. I'll get something that says, Dr. Brown, and here's the bill. And I'm like, I don't even know a Dr. Brown. Never been to a Dr. Brown. What is this for? And when I call, I'll find out it's for this particular lab, and I'll go, oh, that must be the doctor at that lab or the technician at that lab that is contracted with my insurance plan. So I think they try to make sure they're covered in all these different insurance plans, but they can't put everybody in every plan. So sometimes when you contact them back and say, hey, my plan is, this is what my plan is. Did you bill my plan correctly? And sometimes that can change it. Unfortunately, I think in some instances right now, you may be responsible for that surprise bill. I will always tell you that's one of those things I always fight. And if you get into one of those situations, reach out to your hemophilia treatment center, reach out to your health plan. If they can't help you, you can reach out to us. We can maybe try to help get those removed. But that is really what the legislation is pushing for right now, is to say it's unrealistic because you never even see the person who reads your lab work. You never see the radiologist. I don't get a chance to ask them, are you in my network? So I think that is the whole purpose behind, these bits of legislation.
All right, does anyone have any other questions they want to ask Michelle? So we had one come in via chat that says, about every 6 months, I get a letter saying that my treatment has been appealed and deemed medically necessary. It appears my insurance is sending this to an outside agency. Is this something I should be worried about? So far, they all come back as necessary with my hemophilia. As I move into prophy, I am terrified.
Here would be my question, because someone is receiving a notice of a denial. What I would do is, I don't know if you've ever received a notice of denial, but one of the first things I would do is I would reach out to my insurer and I would say, I have a question. I received this notice. It says this has been appealed. My guess is if you're saying it's every few months, I think that what is happening is you probably have a health plan that is requiring a prior authorization every quarter or something along those lines. And so whoever your pharmacy is probably going in to get that prior authorization. Maybe there's a denial that's coming back to them and they're automatically appealing it. And since it's always coming back approved, you know, no one has notified you. However, I would definitely ask my insurance company, or I would ask especially if it's related to your pharmacy, you know, related to your factor product, I would ask whoever is supplying you with your factor product, because you want to know what that process is. You want to understand why it is, because you don't want to be surprised one day if it's denied. And whoever, whether the insurance company is denying it and then the pharmacy is appealing it, there should have been a letter somewhere that someone received that explains why this has been denied, and then there should also be a letter explaining, you know, how it was overturned.
Thank you, Michelle. We have another chat question, and this is a two-part because I'm going to add a part on as a second. So regarding the CMS issued rule in April about copay accumulators, is this only for public plans, for private plans, for self-insured plans? And my follow-up to that is, if you have employer-based insurance and you aren't sure whether your employer is self-funding the plan or not, how do you find out?
Okay. Well, what I will tell you is, first of all, when you think about public plans like Medicaid and Medicare, you typically you're not allowed to use copay cards anyway. So it doesn't necessarily apply to those plans. There's federal rules against using those programs, and typically you don't have a copay with Medicaid. With Medicare, there may be an exception sometimes around the Part D drugs, although factor is covered under Part B, as in boy. So it usually doesn't apply for us in public plans. However, I will tell you that as written, the CMS rule applies to private plans and self-insured plans. I will also let you know that we just met with, just yesterday at the conference I'm at, we had representatives from the Center for Consumer Insurance Information and Oversight, which is CCIO, which is a division under CMS. They are the ones who put out the new rule. And they were at our meeting yesterday and did let us know that they are getting some pushback from some of the self-insured plans. However, they haven't changed anything yet. It still is that, you know, if there's no generic, they have to allow this for these copay cards to count. I guess I would say the cautious side of me says, we're going to have to keep monitoring this to see if there ends up being some adjustment to that rule. The positive side of me says we have a really good relationship with the folks at CCIO. It was really partly from some of our folks going in and meeting with them that they agreed to make this change. We also have developed a really good relationship with a lot of the large self-insured plans. And they have assured us in some cases they've kind of excluded hemophilia, or they've included hemophilia drugs on a preventative drug list. And when they get on a preventative drug list under a HSA plan or a high deductible health plan, what happens is then they're payable $1. You'll have no deductible, no copay. But what I can say is, if you're not sure how your plan is covered, what I would tell you is, in many cases, if you take out your insurance card and you look, it will either be on the front or the back. There'll be a little note that says, this plan administered by, and it may say Anthem, it may say Aetna, if it says administered by, it is typically a self-insured plan. meaning your employer. They are administering it for the employer.
Okay, thank you. That's a very easy and fast way to tell.
Yeah, they didn't used to have that on the cards. I can tell you. So I was pretty excited when I saw that this past year. So
thank you so much, Michelle, for bringing all that information and your troubleshooting of those questions. You are a font of wisdom, as always.
Well, you all have a great rest of your week.
Thank you so much. Thank you again to Takeda and Sanofi Genzyme for sponsoring our 2019 webinar series. Thank you, Michelle.